Cervical or neck retraction extension is one of the most common repeated movement tests I use, and like I always say, that test is often fruitful and therefore becomes the patient's treatment approach, meaning doing it regularly throughout the day. But retraction extension of the neck is done in 3 different ways. Seated, which could be also done in standing, it's the same type of load. Prone on your stomach, which is normally done in a sustained way versus a repeated way. And the third way is supine. And when we say supine on one's back, I mean that the head is coming off the surface. In the office, I use this table, of course. At home, I want patients to use something as firm as they can get. A dining room table, a kitchen counter, a coffee table, a firm armrest with pillows under the hips over a couch. A bed can be used as a last resort, but the problem I find with beds is that they're often soft enough so that the body slopes with the weight of the head, and therefore the fulcrum is not in the low neck as we intend. You could also use a weight bench or a bench or an ottoman. So something firm that keeps the trunk parallel to the ground and allows the head to roll over the end of the surface. So I'll demonstrate the procedure and give you a few notes because there are some pitfalls I see with people doing it correctly. So the patient goes so that the armpit is at the level of the edge of the surface, and then from neutral, retract, extend, a little bit of rotation or manual overpressure, and then using the hand to come back to neutral. So retract, extend, a little bit of rotation, or you can do manual, and coming back to neutral. Now, a couple things I noticed that people do incorrectly. One, they don't get to end range. You need to get to end range either using that small rotation left to right at the end, kind of like a corkscrew, getting the neck to go further, 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 or they can use manual pressure to the chin. Secondly, they're coming back up without hand support, and I really want either 1 or 2 hands behind the neck, bringing it back to neutral. I don't want the joints doing the work in that capacity. And thirdly, they'll often come up higher than neutral. It's not a huge deal, but I don't want to put the neck into some flexion if I can avoid it. I want the exercise to be from neutral to retraction, extension, going into end range extension. So this can be a powerful treatment, if it's the right treatment, of course, for the diagnosis of a derangement in the neck or in the very upper thoracic spine. There are patterns we tend to see, or at least I tend to see. I tend to see it for patients if they don't resolve in prone or in sitting. I'll often look at this. So patients who might respond to the other ones, but not completely. And secondly, if there's someone with a really large disc derangement, I tend to see them respond to this more than in sitting because we need that space and gravity to help us get over that posterior or posterior lateral displacement of the disc. And those patients are usually presenting with kind of severe or at least significant radiculopathy or radiating pain into the upper extremity. So I don't use this one as much as the prone version or the seated version, but it can be a very valuable test. And if it shows that the baselines, the symptoms, and the mechanics get better with it, then it becomes the home treatment and can eventually become the end-all be-all treatment for that patient.